What are you finding are the reasons that people are not connecting to care in America?
I think there's a lot of reasons, and one of the reasons we're finding in the South is the stigma around HIV. That's a big issue and a big barrier that people don't want to be tested because they don't want to know, and because of the stigma once you get diagnosed. So we're actually having a lot of people who are getting diagnosed in ER when their T cells are really low and their viral load is really high, because they're just waiting. And that lack of education, we think 30 years later people know a lot about HIV, but they don't.
I've been living with HIV for 16 years now, and I have to say that while there is a general, there's more knowledge about HIV, but I would argue that the stigma is just as bad as it ever was. What's your experience? Have you seen it get better? Is it still as bad? What does it feel like to you?
I don't think it has got better, because until somebody has been infected or affected, people always think it's those people. Right. It happens to somebody else. And especially in the minority community, we don't like to talk about death or sex.
So what do you do in your work to get people talking comfortably about sex? And is this work that you do with doctors and also in the community? How do you make people more comfortable? How do you fight the stigma?
I think the first thing you need to do, like I say, you don't need to judge people, because people do everything we say, everything we do is natural. Yeah. And it's not you, it's us. So we always say, you know, there's always a fine line between those we serve and us. Anything that can happen to my clients can happen to me. This is my community, and I always try to bring that we are here to work together, and I'm not above them. I'm here to enrich, to give them resources. Let's talk about it. Tell me what's happening. How can I best help you?
We also hear this, that, you know, HIV is not the primary concern in many people's lives. They become, you know, aware of their status. But many people, particularly in the South, are living in such challenging everyday situations that HIV is distant. And I've seen this in the developing world too, where when you don't have housing and you don't have food and you don't have, you know, basic safety or dignity in your life, it's very difficult to think about the future of your health. Is that something that you've encountered?
Yes, I think that's why Bristol-Myers has done such a wonderful job in working in coordination with partnering with the people down on the community doing the work. So we just don't work with the healthcare providers, but also people who are providing services in housing, people transportation, food pantries, and we try to link all those people together and build those partners, kind of help to facilitate those partners so we can meet all the needs of our clients.
What enables people to stay in care and invested in their health?
I think the first is for somebody to acknowledge that they are worth something. Yeah, that they need to be here. They are here for a reason, and that this journey they don't have to walk by themselves, and to empower them. And so we do that through education. What is it? We try not to have them identify, because sometimes I ask patients, who are you? And they say, I'm HIV. I'm like, oh no, you're not HIV. You have a virus. Yeah. But what is your name? Trying to have them identify by who they are, empowering them, and start having them engaged in their own treatment and in their lives to live healthy.
If you could wave a wand and you could change 3 things tomorrow in the communities that you see, what are the 3 things that you think would make the biggest difference to fighting AIDS in America?
Well, that's a lot of power. I think the first thing for me is for the community to acknowledge that we have HIV in the community, that it is affecting us as people, and to show that passion, and to know that it can happen to anybody. None of us are immune to having HIV. I just think that's the best thing to start, and to show that love for anybody who's HIV, is to not start judging. I think if you start there, anything else, I'm gonna cry, sorry. Anything else we can work out. When it comes to funding, education, we can provide that. But I just don't know how to get in people's hearts to accept, especially when you see what we see in the ground. Because a lot of times we see the statistic that half of the new infections are in the South. But as you know, every 9.5 minutes,
yeah,
somebody's infected.
Yeah.
And those are all statistics, but I see the
it.
faces every day, and I hear their stories. And to me, they are already survivors, knowing what they are going through and what they have been through. And so my magic one is just for people to open their hearts and start accepting and say, this can happen to anybody. How can we work this together as a community?
Can we do this? Can we end AIDS in America?
Of course we have to. We have to.